We will continue now with our deliberations. Item 5, Vaccine-preventable diseases and immunization, realizing the full potential of the European Vaccine Action Plan 2015-2020. I shall now open the debate, and I have the following speakers on my list: Poland, Monaco, Lithuania, Russian Federation, Germany, Slovakia, Tajikistan, former Yugoslav Republic of Macedonia, Turkey, Ukraine, Belgium, Bulgaria, Hungary, France, and Republic of Moldova. Are there any other member states requesting the floor? Please raise now your nameplate. So this is the list. Oh, Azerbaijan. Okay. I now give the floor to the delegate of Poland, followed by the delegate of Monaco. Poland, please.
Thank you, Mr. President. Poland would like to thank the Regional Office for its report on realizing the potential of the European Vaccine Action Plan 2015-2020. Poland fully supports the work done so far and declares its commitment to the global fight against vaccine-preventable diseases and within the field of immunization. Since many years, Poland has been implementing a universal immunization program. It is systematically modified and broadened in accordance with current medical knowledge. The introduction of compulsory vaccinations reduces the social cost associated with serious health consequences of infectious diseases. Universal vaccination is the most effective way to eliminate the threat of commonly occurring infectious diseases, in particular among children. However, attention should be drawn to the fact that in the recent years, the anti-vaccination movements are getting stronger. In spite of all the efforts, the number of vaccination opponents in Poland is growing, and they are becoming more effective and more active. Similar situation can be noticed in other European countries. Europe is currently experiencing the return of measles, a disease which is planned to be eradicated till 2020. That leads to the conclusion that new efforts in combating the reluctance to vaccinate must be taken up and existing activities must be strengthened. Thank you.
Thank you, Poland. I give the floor to Monaco, followed by Lithuania. Monaco, please.
Merci, Monsieur le Président.
Thank you, Chair. Chair, we would like to begin by thanking the Secretariat for this midterm review of the Action Plan. Vaccination is a key public health intervention, and it's something that has a very good cost-benefit ratio. Chair, this report highlights shortcomings in data collection in particular. That being so, my delegation wishes to recall the problems encountered by the smallest countries in that regard. Statistics are distorted by the fact that sampling is very small, and also that we have a number of foreigners who are being treated in Monaco because of the agreement we have with France for mutual health care. We wish to express our concern about the measles epidemic that is raging within the European region at present, with more than 40,000 cases that have been identified, including in Monaco. We therefore support the activities undertaken by our government. We focus particularly on accessibility. We also recognise that the cost of vaccination is covered 100% by social insurance bodies. The rate of vaccination is around 80% covered by that system and the other 20% by private health. However, seasonal vaccination is covered 100% by our public health system for certain vulnerable categories such as pregnant women and persons over 65. That's very important then, access to vaccines. Secondly, communication. We know that there are people who are reluctant to accept vaccination, and getting the proper information over to those people is vital. During the European Vaccination Week in 2018, our campaign focused on child vaccination. It was called "I'm going to protect my child, I'll vaccinate my child." And the campaign aimed to inform the general public about vaccines through a number of little sketches where there were questions and replies, and you were asked to say whether something was true or false. We made this information available in doctors' surgeries, in creches, in schools, and in other centres. As well as that, we had information on the government's webpage. When it comes to information, we also support vaccination campaigns internationally. We work with Gavi and with WHO through the polio eradication initiative in particular. Thank you.
Thank you, Monaco. Lithuania, please, followed by Russian Federation.
Thank you, Mr. President. Lithuania commends the work done by the WHO Regional Office for Europe in the area of vaccine-preventable diseases and immunization, and welcomes this midterm review. Lithuania agrees that focus and political commitment must be maintained to eliminate measles and rubella until 2020, as foreseen in the action plan. Therefore, we have to increase vaccination, improve quality of epidemiological surveillance, determine and immunize high-risk groups, and improve trust in immunization programs. We have to keep our eye on polio to maintain polio-free status. In our region, we have achieved polio-free status because of decades of successful implementation of immunization programs, and total elimination is not far away. Lithuania has implemented several successful measures as well. The most recent of them are human papillomavirus vaccination, which started from 2016, as well as vaccination from B-type meningitis for children, which was included in the national vaccination program starting from 2018. We would also like to stress the importance of education and mass media to achieve the necessary level of population acceptance of immunization programs. Diseases such as measles are rare among residents, and polio is almost forgotten. The last case in Lithuania was registered in 1972. Therefore, people more and more tend to question the necessity of vaccination, and more fake news emerge in mass media. We hope that we will manage to cope with this challenge as well. The midterm review clearly outlines the importance of and the need for political commitment and continued advocacy, and we hope that under the leadership of the WHO Regional Office for Europe, we will be able to achieve the agreed targets. Thank you.
Thank you, Lithuania. Russian Federation, please, followed by Germany.
Thank you, Chair. Chair, the Russian delegation has looked at the review of the measures that have been undertaken within the auspices of the EVAP work, and generally speaking, we commend the recommendations that have been formulated within the document. The Russian Federation is indeed working to achieve the SDGs in particular, and one of the targets we have is, of course, eradication of polio. We have a national plan to that end in order to ensure that we can have polio-free status that is achieved and maintained in our country, and also that we have the necessary coverage by vaccination, which indeed is above 90% at present, and we are taking necessary corrective measures as required. As well as that, we have established a containment body at national level. We have an epidemiological surveillance system for measles and rubella, and we seek also to combat those infections. Indeed, in September of last year, our government decided to launch a 3-year program to give support to a number of countries within the European region, Mongolia in particular, again to focus on surveillance of measles and rubella. As well as that, we have established a technical group of experts that is an advisory group on immunization, and that is working on gathering data as to how we can improve preventive measures within our country for a whole range of different diseases and infections. We are doing ongoing work then. We have stable funding for the work that is being done, provided at state level, and we focus especially on improving the data that we collect on immunization and on surveillance, and also on training for our health personnel. As we see it, we need within the European region to consolidate the work done by different countries under the auspices of this programme, focusing especially on border areas. We need to look especially at ways in which we can cover especially vulnerable groups and target groups such as migrants. We need to get specialists to where they need to be. We need to enhance our laboratory network, and we need to strengthen our mutual cooperation. Thank you.
Thank you, Russian Federation. Germany, please, followed by Slovakia.
Vielen Dank, Herr Vorsitzender. Deutschland begrüßt
Thank you, Chair. Germany welcomes this midterm review. It gives us a good overview of where we stand in terms of implementation of EVAP. We see that the measles epidemic that has recently been observed in our region emphasizes the importance of this issue. It is vital that we increase vaccination coverage throughout our region. We must indeed ensure that we fill in the gaps. We therefore support the policies that have been formulated to enhance vaccination and to ensure the take-up of it is greater. We think this has to be our priority among WHO's activities in Europe. And we wish to express support for the goals that have been identified as part of the implementation of the plan. In conclusion, I would like to thank WHO Europe for what they have done. Indeed, this midterm review has shown that we are close to achieving some of the goals, or at least we've moved closer to them. One concern, however, is the drop in vaccination rates, also the measles infection that I refer to, as well as some long-term funding issues with vaccination programs and the question of how to maintain public trust in some areas in vaccination. A number of speakers have already underscored those points. The action plan has ambitious goals. In some areas, we still have a long way to go. That means that we need to be even more committed to our objectives. Vaccination is and will remain a key public health issue for our people. In future, increasing the rate of vaccination as well as introducing new vaccines are things that could prevent other diseases and save lives. Each member state in their own country must take the necessary steps to ensure that we can achieve that goal. In recent years, Germany has taken legislative measures and has made structural changes to its system. We have thus increased our political commitment to vaccination. For instance, we have a national vaccination plan. We also have a national anti-measles plan at national level. And we have a system where there is a mandatory medical consultation on vaccinations that are recommended or that are required before a child can be taken into a creche. We have then a vaccination plan that ensures that vaccination goals are understood and are backed up by robust and valid data. Data is vital if we are to intervene where required and to understand the scope of the challenge that we face. If we look at our vaccination rates by different age categories, we do have a breakdown of our figures, and with the assistance of WHO, we have studied the extent to which people in different categories are willing to accept vaccines. What we have done has shown that targeted intervention and legislative change can enhance prevention of disease through vaccination. In Germany, we are very much committed to vaccination, and we wish to thank WHO for its support to us. Thank you.
Thank you, Germany. Slovakia, please, followed by Tajikistan.
Thank you, Chair. The Regional Director, distinguished delegates, the Slovak Republic strives to fulfill all goals set in the European Vaccine Action Plan 2015-2020. We provide comprehensive vaccination against the most serious infection diseases without any additional payment from our citizens, and we strive to ensure the highest degree of vaccination despite the negative impact of groups refusing vaccination. Despite the low incidence of most infection diseases in Slovakia, we are aware of the need to closely monitor the situation to prevent the introduction of diseases into areas with lower vaccination rates. In July 2018, we started the seroprevalence study for immunologic overview in 6 diseases: measles, mumps, rubella, viral hepatitis A, B, and C. in order to identify the status of immunity of the Slovak population and check the effectiveness of current vaccination. Thank you for your attention.
Thank you. Tajikistan, please, followed by the former Yugoslav Republic of Macedonia.
Уважаемый председатель, уважаемые
Chair, colleagues, ladies and gentlemen, Tajikistan wishes to express its commitment to the European Vaccination Action Plan and its goals. Coverage by vaccination has succeeded in significantly reducing disease burden in many cases and has proved its worth and its success. We therefore also welcome this midterm review of EVAP. And we see what we have achieved, and we also see where we have to go and the further possibilities we have for enhancing the protection of children. When it comes to measles, this clearly shows that there is a very serious problem in terms of a gap in coverage within the European region, and this is something that is of concern to our people, and we must ensure that we can protect them through immunization from something like measles. Through immunization and through a fast response in this kind of case, we can prevent further spread of this and other diseases. We wish to thank WHO for the support they have given us, technical support in particular. They helped us, for instance, in 2017 to respond to an outbreak of measles. And thanks to their technical support, we were able to vaccinate around 2 million children between the ages of 1 and 9. This timely response in Tajikistan allowed us to keep our status as a country that is free from endemic measles and rubella. We also notice that, in fact, back in 2012, we had a problem where on our border with Afghanistan, we saw type 1 wild polio virus cases. Again, thanks to the support of WHO, we were able to take very rapid response measures, and we were able to ensure that the import of this virus from Afghanistan was checked thanks to an immunization program for children under the age of 5 in the border areas. Technical support from WHO has played a very significant role then in that and in a number of other cases also, and has helped us to introduce various new vaccines into our country's inventory and register of vaccine. For instance, we have significantly been able to reduce the disease burden within the country as a result of that. So we are very grateful to WHO. We are grateful for the fact that we have been able to improve the quality of our vaccination program. We know the importance of immunization, and that is recognized by our health minister, which has recognized that vaccination is one of the priority preventive measures that we have for public health within Tajikistan. We hope in future to continue to work very closely with all our colleagues in WHO in order to achieve further success. Thank you.
Thank you. The former Yugoslav Republic of Macedonia, followed by Turkey.
Thank you, Mr. President. Your Excellencies, distinguished delegates, ladies and gentlemen, Madam Regional Director. Thank you for your information. Midterm review document with reference to the vaccine-preventable disease and immunization, realizing the full potential of the Europe Vaccine Action Plan 2015-2020. The Southeastern Europe Health Network demonstrates consistent high-level political support towards strengthening immunization and to decreasing the vaccine-preventable disease through the organization of the Southeastern Europe Health Ministerial Meeting held in February in Montenegro in partnership with World Health Organization Europe. At this ministerial meeting, Southeastern Europe Health Ministers of Health endorsed a statement of intent which acknowledged the importance of vaccination and which launched the process of developing a regional roadmap with specific strategic objectives and targets to improve the impact of national immunization programs. Additionally, I would like to highlight with pride that since 2016, all countries of the Southeastern Europe have achieved full financial sustainability of the national immunization program. Acknowledge these major challenges and recognize the value of immunization in terms of health, social and economic returns. the subject was once again an important agenda item at the ministerial meeting in Tel Aviv on 10 July 2018. The discussion reviewed the situation and, among other items, considered options for the securing access to affordable vaccine supply, evidence-informed decision-making, and sustainable financing for immunization. One on the identified solutions to be taken forward was to create a joint vaccine procurement in the Southeastern Europe Health Network countries. In this respect, Southeastern Europe supports the initiative to create a regional immunization technical advisory group which will take forward the joint procurement initiative through, for example, as a first attempt, the joint planning and procurement of pandemic influenza vaccine. We call on our Southeastern Europe governments and our major partners, World Health Organization Regional Office for Europe, to work jointly with relevant stakeholders and interested partners to identify and recommend the most effective mechanisms to address comprehensively and overcome sub-regional specific challenges. On behalf of Ministry of Health of Republic of Macedonia, I state that this document is very valuable and my country expressed support to the monument created along with the necessity to leverage additional commitment to implement the objectives of the EVAP. Republic of Macedonia, as middle-income country with around 2,000 citizens and with birth cohort of around 24,000 per year, had a good tradition and history in immunization. In 2017, we have detected the lapse coverage of immunization going even to 82% from MMR, morbidity, mumps, rubella vaccine. By the government decision set in May 2018, starting from 2019, the funds for this immunization program will be 70% higher than 2018, what gives the opportunity to introduce pneumococcal vaccine and rotavirus vaccine in the immunization schedule to replace with IPV vaccine according to World Health Organization recommendations. Setting these two new vaccines in the immunization protocol and using only IPV vaccine, the new immunization calendar starting 2019 will be completely in accordance with World Health Organization recommends. Starting 2019, a single integrated electronic record system by special IT immunization model will be introduced as a part of electronic health system, what will give great input in gathering data, surveillance and immunization coverage and provide possibility to plan vaccine procurement. Thank you for your attention.
Thank you. Turkey, please, followed by Ukraine.
Thank you, Chair. Dear Regional Director, distinguished delegates, dear colleagues. As we all repeated many times, immunization is the most cost-effective public health intervention against the threat of communicable diseases. However, having high vaccine coverage is not an easy job. It requires financial sustainability, dedication of health workers, good communication, and political commitment. The document emphasized success of our region in interruption of epidemic measles and rubella transmission and maintaining polio-free status. However, the midterm review report also shows us how hard it is to sustain progress in immunization coverage. The report underlines increasing and decreasing coverage ratios. What we should focus here is the challenge we face after we achieve 90 to 95% of coverage. The small proportions left out of coverage are the hardest ones to reach. Therefore, we have to develop our policies to achieve full coverage as much as possible by reaching these hard-to-reach groups. Besides, we should be aware of activities of anti-vaccine groups. Mandatory vaccination is like a dream for every country. However, it brings many challenges. In this manner, communication strategy seems to be the most important element. WHO should develop a common communication language for promotion of immunization. Member states can fine-tune afterwards, depending on cultural differences. Thank you, Chair.
Thank you, Turkey. Ukraine, please, followed by Bulgaria.
Thank you, Chair. Madam Regional Director, Mr. President, Ukraine welcomes midterm review of the European Anti-Vaccine Action Plan. Following EVAP goals, we would like to share recent improvements on immunization activities in Ukraine. In 2015, Ukrainian Parliament endorsed law aimed at transferring drugs and vaccine procurement to the international organizations. UNICEF was chosen as procurement agent for vaccines, and finally, 2018 became the first year for a decade when no shortage of vaccine was observed in the country, except inactivated polio and rabies vaccine due to the shortfall at the global market. To follow best international practices, early this year, Ukrainian government approves 3-year planning and budgeting for immunization programs and endorsed using WHO forecasting tool for vaccine. Thus, we are applying to UNICEF to cover 3 years' nationwide needs recently. New immunization strategy is submitted to the Cabinet, aiming at strengthening national surveillance over the vaccine-preventable diseases and capacity building at the primary health care to ensure appropriate vaccination coverage in the country. I would like to underline these changes were achieved due to the personal commitment of Prime Minister of Ukraine and proactive position of the whole Cabinet, especially during the recent measles outbreak. With this political support and technical assistance from WHO and UNICEF, we were able to introduce supplementary immunization activities among children and free of charge access to vaccine immunization and immunization services for adults from risk groups. As of midsummer 2018, we have achieved 90% vaccination coverage against measles. At the same time, we would like to stress and address 3 main topics where cooperation and assistance at the regional level is required. As mentioned by Serbia yesterday and another country, anti-vaccination campaign and movement become the new pandemic in Europe and require strong joint action to reaffirm trust to vaccination programs. We need to enhance the coordination, meaningful involvement of stakeholders who initially was not counted as a participant, and establish the new programs to contradict the anti-vaccination activities. Due to the increasing global vaccine demands, we asked WHO to call negotiation process with stakeholders, including industry, to improve affordability and availability of vaccines at every site in the European regions. And finally, due to war on the east of Ukraine and annexation of Crimea by Russian Federation, Ministry of Health of Ukraine does not operate with any information on the vaccination status of those territories. We urge WHO regional office to plan independent international assessment of situation either in Crimea or NGCA in the east. Thank you very much.
Thank you. Bulgaria, please, followed by Hungary.
Thank you, Chair. Madam Regional Director, Honorable Ministers, distinguished audience, Bulgaria aligns itself with the report and its recommendations. I would like to share with the audience the initiatives Bulgaria has undertaken and the achievements made in the area of vaccine-preventable diseases and immunization for the period 2015-2017 of the EVAP. The data from the surveillance of vaccine-preventable diseases and immunization for the period provide evidence-based proofs for the achievements in the first 3 strategic goals of the action plan as follows. Strategic Goal 1. Bulgaria has been polio-free since 2002. The last update of the National Polio Outbreak Preparedness and Response Plan was in July 2018. According to Polio Eradication and Endgame Strategic Plan 2013-2018, all steps in achieving polio virus containment in the country are in place. Strategic Goal 2. Despite of the steady increase in the immunization coverage in 2017 for both doses, 93.8% compared to 92.1% in 2016 for the first dose, and 91.6% compared to 88.3% for the second dose, the results are still not fully satisfactory. More efforts are needed to achieve and maintain a measles elimination status in the country. Strategic Goal 3. After the introduction of routine hepatitis B immunization in Bulgaria in 1992, for 25 years there has been a steady decline in the reported cases of acute hepatitis B in the age groups which have been immunized. What is more, in order to achieve the WHO strategic Goal 2 on eradication of measles and rubella in the European region, a draft national program for the eradication of measles and rubella 2019-2022 has been developed with two main objectives: to increase immunization coverage and strengthen surveillance of measles and rubella in the country. The main activities concern the minimization of population susceptible to wild-type measles and rubella viruses, the achievement and maintenance of over 95% coverage at both doses, the provision of additional immunization against measles and rubella in groups at increased risk of infection through targeted campaigns, and strengthening the national surveillance system for measles and rubella. For the first time in the country, a national seasonal influenza prevention program with a special focus on people over 65 has been developed and ready to introduce, as well as a vaccine reimbursement system for these risk groups. Particular attention is paid to working with vulnerable groups such as Roma children, and a network of Roma health mediators has been created, working in municipalities but paid by the state budget, that cooperate with the health authorities during the implementation of the immunization calendar and other activities related to public health. Besides, a national program for primary prevention of cervical cancer 2017-2020 and a national program for control and treatment of rotavirus gastroenteritis in Bulgaria 2017-2021 are being implemented. In line with the EVAP 2015-2020, the regular activities during the European Immunization Week in the country, and the information campaigns on vaccine-preventable diseases, the emphasis on measles prevention and elimination have contributed to improving the awareness of civil society and updating the knowledge of medical specialists in the field. During the period, we have had fruitful cooperation in the field of prevention of vaccine-preventable diseases, both with the WHO Regional Office for Europe and with the European Centre for Disease Prevention and Control. Finally, Madam Regional Director, I would like to extend the government's gratitude to the WHO Regional Office for its continuous technical support and guidance provided in the area. Thank you very much.
Thank you. Hungary, followed by France, please.
Dear Regional Director, Chair, distinguished delegates, vaccination is one of the greatest public health achievements in history. In Hungary, the history of mandatory vaccination has been going back over 100 years. As a result of the consistent implementation of the vaccination program, several serious infectious diseases have virtually disappeared from our country. There is no child dying in Hungary due to infectious diseases that can be prevented by vaccination. Currently, there are 11 mandatory vaccines. Coverage of the mandatory vaccination has been shown very good rates for decades, with a 98% level of all vaccine types. Within our mandatory vaccination system, high-quality, efficient, and safe vaccines are provided for free of charge by the government. The system ensures equal access and has a solid legal background with governmental responsibility. The national vaccination program complies with the conditions set up in the WHO European Action Plan on vaccine-preventable diseases. Among the vaccine-preventable diseases, large epidemics can be caused by measles. Measles vaccine in Hungary was introduced 50 years ago as mandatory vaccine. Over the past 20 years, vaccine coverage rate has risen above 98%, and Hungary could fulfill the conditions of measles elimination in 2015. High vaccination coverage rate can be achieved and maintained by mandatory vaccines, as proved by a change in the performance of the pneumococcal vaccination. By PCV vaccination was voluntary, the coverage rate did not exceed 96%, but it was above 99% when the vaccine became mandatory. We are in the process of developing a national hepatitis C virus elimination plan. As an initial step, centrally coordinated screening of healthcare professionals will start this year. HPV vaccination is organized centrally. The uptake is on voluntary basis and free of charge. I'm happy to share with you that in October in Budapest, the World Health Organization, together with the UNICEF, is organizing a global meeting with member states and global immunization partners. I hope that we can greet you there to share our experiences. Hungary stands committed that immunization will remain a priority among the country's preventive public health programs. Thank you very much.
Thank you, Hungary. France, please, followed by Republic of Moldova.
Thank you, Chairman. Regional Director, Chairman. Ladies and gentlemen, France welcomes the mid-term review report of the European Vaccine Action Plan and welcomes the progress that has been made by WHO's European region between 2015 and 2017. We are aware that efforts need to continue to be made to keep up our progress, and we need to mobilize more resources and get better political support and commitment. France has placed the question of vaccination at the heart of its national health prevention strategy so as to fight against the return of serious infections and outbreaks. Compulsory vaccination of children has been extended this year from 3 to 11 immunizations, and we now have a website for information of the public that's been there since 2017. We've taken several measures to make things easier for users and to improve vaccine coverage. We welcome the mobilization of the European Union, which has provided a framework for stepping up cooperation on vaccine policy and which finances joint action. This will make it possible for member states to work on making their databases interoperable, improving access to vaccines, and collect helpful data on efficacy. It will also foster exchange of good practices, which in its turn will boost, we hope, the trust of the public in vaccination. We would like to see strengthened cooperation with all countries of the WHO European region, given the challenges facing vaccination and in order to help us attain the Sustainable Development Goals. Thank you.
Republic of Moldova, please, followed by Azerbaijan.
Mr. Chair, thank you very much. Madam Regional Director, Honorable Ministers, dear colleagues, thank you for an excellent midterm review report on the implementation of European Vaccine Action Plan 2015-2020, which we fully support and read with the agreed interest. Republic of Moldova stands committed to achieving and sustaining the goals in the European Vaccine Action Plan. The Ministry of Health, Labour and Social Protection ensures that immunization remain a priority among the country's preventive public health programs. We acknowledge the values and benefits of immunization, and we commit ourselves to the principles in the Statement of Intent endorsed during ministerial meeting in February this year in accordance to the Chisinau Pledge to sustain and strengthening regional cooperation in public health in Southeastern Europe and achieve universal health coverage. The immunization program in the Republic of Moldova has been strong and well-performing, but it has recently experienced a decline in coverage rates and we are below the 25% thresholds for most vaccines. The country has noticed wide variation in the coverage between districts, especially in the Transnistria region, and this is our concern. The decline in vaccination coverage including the reported measles case in 2018, vaccine, threatening the measles elimination status of the country. Such situation bestows an additional responsibility on us to keep our community safe from vaccine-preventable diseases through high vaccination coverage and ensure repeat response to any potential of these diseases to limit their spread. The Republic of Moldova would like to thank WHO Regional Director and her technical staff for timely and highly quality support, expert advice provided during measles outbreak in August this year. The Republic of Moldova, our immunization program, commits to collaborate with the WHO Regional Office to identify specific barriers to vaccination and tailor the country's immunization program to specifically address vaccine hesitancy among some population groups, sustain high demand for vaccination, including specifically for human papillomavirus vaccine, helping healthcare professionals to become better advocates for immunization and communicating better to benefits for immunization to the general public. Increase capacity to monitor and report to adverse events following immunization. Ensure use of the best available evidences for decision-making for policy and decision makers, including the National Technical Advisory Committee. Ensure long-term financial sustainability and strong political support to the immunization program. Thank you, Regional Director, and your teams in Copenhagen and Chisinau for your dedication to our common goal of ensuring a health start and a childhood free from vaccine-preventable diseases for every child in the Republic of Moldova and the European region. Thank you.
Thank you. Azerbaijan, please, followed by Kyrgyzstan.
Chairman, ladies and gentlemen, fighting vaccine-preventable infections is something which is a priority for us at country level. We have been working hard to eliminate measles, rubella, and polio, and we will only have success if we have proper epidemiological surveillance and manage to take the right preventive measures. At the same time, we need to bring in new vaccines. We need to improve the legal basis on which we operate, have a greater political support, and differentiate our approaches to the groups with whom we're working. At the same time, when we have outbreaks of certain diseases, often they're as a result of hesitancy to accept vaccination. And we need urgently to take measures to enhance our population's trust in vaccination. Only that way can we increase the coverage levels and spread the use and acceptance of all positive vaccines. Thank you very much for your attention.
Thank you, Azerbaijan. Kyrgyzstan, please, followed by Russian Federation.
Thank you very much, Regional Director, Chairman. Ladies and gentlemen, colleagues, Kyrgyzstan is very much attached to achieving the goals of the European Vaccine Action Plan and is taking all necessary steps to ensure access to good quality immunization services. At local, national, and regional level, we are trying to ensure that we can implement our vaccine plan in synchronization with the European Action Plan and harmonize our national program as part of the overall reform of our health system. We're doing all this in line with the 2020 plan and our National Sustainable Development Plan. We, of course, are a member state of the European Regional Office, and we support initiatives being taken as far as liquidating poliomyelitis is concerned and getting polio-free status. We have a high level of vaccination. We try to make our epidemiological surveillance effective so that it can detect any suspected cases of poliomyelitis and so that we can get it eliminated and get polio-free status in full. We're hoping that that will happen soon. We've moved to the latest type of vaccination, one dose of inactivated polio virus. We hope that we will get a certification soon, as I said. On eliminating measles and rubella, we are trying to integrate that in our overall epidemiological surveillance system again so that we can detect any cases and any possible outbreak. Vaccination, together with an effective epidemiological surveillance system, has already brought us positive results. We have brought down the levels of morbidity and mortality from vaccine-preventable diseases, and that is positive. Over the last 8 years, we have had no deaths from diphtheria. We've brought down the level of mortality and morbidity from other infections as well. We have had positive improvements, and generally speaking, in the Kyrgyz Republic, we will keep the vaccination program as one of the main priorities within our health-related activities. Over the last few years, however, we have had a drop in our level of vaccination coverage. That's happened in most of the regions in the country. And we do have a problem of people refusing to accept vaccination. Obviously, we need to step up the efforts we've been making to fight the anti-vaccination information that is around so as to increase acceptance of vaccination. Our health ministry is intending to carry out an information campaign among the population to promote acceptance of vaccination. We're working with other partners, including UNICEF, on that, and we hope that the communication campaign on which we intend to embark will change the situation. Thank you.
Thank you. Russian Federation, please.
Thank you very much, Chairman. Chairman, heads of delegation, regional director, we regret the fact that this session is being used by the representative of Ukraine to politicize the discussion, and we do not accept the comments that delegation made about the Russian Federation. This is a UN specialized technical agency dealing with health matters, and we would like to continue to discuss health matters and have a positive dialogue without politicization so that we can better protect and promote the health of our peoples. That is the goal for which we have come to this meeting today. Thank you.
Thank you, Russian Federation. And now I give the floor to the United States as an observer.
Thank you, Chairman, Regional Director, Honorable Ministers of Health, ladies and gentlemen. The United States welcomes this progress report on the actions in the European Vaccine Action Plan to achieve the goals of measles and rubella elimination in the region. While acknowledging progress, it is important to note two major areas of concern. Over 41,000 cases of measles in the region and 8 countries experiencing large measles outbreak. These outbreaks, unless direct action is taken now, will impede the region from achieving the regional goal of eliminating measles. As the Director General said in his remark, while there is no silver bullet, measles outbreaks can be stopped by rapid detection of measles cases and high measles vaccine coverage to prevent further spread. High-level political interventions, prioritizing stopping measles outbreaks, and highlighting the importance of immunization to increase demand is critical at this time to achieve the regional goal. Measles is a key indicator of the health of a nation's public health system. The immunization program is part of the backbone of a national preparedness and response system to prevent, detect, and respond to public health threats. The current outbreaks are a warning that public health systems are not as healthy as they should be. In the region of the Americas, measles-free status has recently been lost, reinforcing that the gains are fragile. We are committed to our collaborations and supporting the WHO European region in achieving its goal of eliminating measles and rubella from the region, and we stand ready to advocate for the required actions so that all children in the future will live in a measles-free world. Thank you.
Thank you, United States. And now I have to give the floor to non-state actors that have asked for it, and we have a joint statement of World Organization of Family Doctors, World Federation of Occupational Therapists, European Forum for Primary Care, Council of Occupational Therapists for the European countries, Studiorum Medicus Mundi International. Mr. Ligidakis, please.
Thank you, Chair. Dear Regional Director, esteemed delegates, ladies and gentlemen, I am Haris Ligidakis. I am from WONCA Europe, and this is a statement from the European and World Federation of Occupational Therapists, the European Forum for Primary Care, Medicus Mundi International, Studiorum, and the European Network of the World Organization of Family Doctors, WONCA. Vaccine-preventable diseases, like measles, have hit a record high in the region. With any vaccine-preventable disease, one case is one too many. People refusing vaccination, those who are skeptical or hesitant, and those who are late or selective vaccinators are part of the population served in primary healthcare. We need action in all directions, including programs that are developed bottom-up. The NGOs supporting this statement would like to call for joint action to achieve: first, renewed and enhanced focus on immunization in primary healthcare. Second, changes in laws for the support of vaccination programs. Third, access to resources of evidence for those working in vaccination programs. And finally, increase in vaccination coverage and elimination of immunity gaps, including those of migrants and refugees, for whom their inclusion in free-of-charge programs must be guaranteed. Finally, we would like to reaffirm our commitment that primary healthcare professionals, such as family doctors and allied primary health practitioners, will continue working with determination to tackle misconceptions and counter misinformation regarding vaccination, strive to provide evidence-based knowledge to the general public and improve its health literacy, and finally, foster the public's trust in health institutions, authorities, and immunization programs. Thank you.
Thank you. And now we have a joint statement of International Federation of Medical Students Association, European Medical Students Association, and European Forum for Primary Care. Mr. Birk Bachnemann, please.
Thank you. Honorable Chair, distinguished delegates, we fully recognize the importance of immunization programs, and we applaud the efforts made by the WHO European region to carry out the European Vaccine Action Plan. While we highly appreciate all the achievements made thus far, we must also raise some concerns. The remaining polio immunity gaps, the fact that the region is not on track to achieve elimination of measles and rubella by 2020, and the decrease in the number of member states with a 95% or greater national DTP3 vaccine coverage alarm us. We're also worried about the inequities in immunization coverage and the challenges faced by some member states in financially sustaining their immunization programs. In order to reach the EVAP goals, we urge all member states to develop and sustain strong immunization programs and to expand and strengthen surveillance systems to generate needed information. Political will to achieve the Sustainable Development Goals also implies achieving vaccination for all. Today, we renew our commitment to make sure vaccination remains a global and national priority. It is the right of every child to live free from vaccine-preventable diseases. As healthcare professionals of tomorrow, we expect all member states to make this right a reality by achieving the EVAP goals by 2020. Thank you.
Thank you. And now, European Public Health Association, please.
Thank you very much, Mr. Chairman. Dear colleagues, following our written statement, the European Public Health Association would like to highlight two important considerations related to vaccination in the European Union. Firstly, EUFA underlines its concern at falling confidence in vaccinations. The decrease in confidence is fueled by fake news and linked to bots on social media. This manifests in lower herd immunity and outbreaks of measles, a disease which several European countries considered having eradicated. Secondly, we would like to highlight that political support and leadership remains of paramount importance. Achieving a better understanding of political processes and the role they play in determining stances on vaccination policy is an important avenue to help us communicate and better address genuine concerns, as well as tackling organized purveyors of fake news. Earlier this year, UFA published the e-collection, Facing the Facts, Challenges in Vaccination in Europe. This e-collection reflects on challenges in vaccination in the European region and includes a selection of scientific peer-reviewed articles recently published in the European Journal of Public Health. UFA will continue to provide the evidence base and will continue to collaborate with the European Commission, the European Centre for Disease Prevention and Control, and of course, WHO Euro. Thank you very much.
Thank you. And now, please, the Standing Committee of European Doctors.
Mr. President, Madam Regional Director, Honourable Ministers, distinguished delegates, thank you for the opportunity to submit an oral statement to this 68th session of the WHO Regional Committee for Europe. The Standing Committee of European Doctors, the CPME, welcomes the review of the document Vaccine-preventable diseases and immunization, realizing the full potential of the European Vaccine Action Plan 2015 and 2020. The CPME reaffirms that the prevention of communicable diseases through vaccination is safe and effective. CPME encourages doctors and other healthcare professionals to deliver facts about vaccination and increase awareness about the benefits of immunization to ensure good vaccination coverage across Europe. CPME also supports measures to increase doctors' own vaccination coverage. At the same time, it should be ensured that doctors are equipped to understand perspectives and barriers to vaccination among populations with low vaccine uptake. The CPME is participating in the new EU Joint Action on Vaccination, which aims to develop common and durable cooperation to build concrete tools useful for EU and non-EU member states' health authorities. Thank you, Chair.
Thank you. International Pharmaceutical Students Federation, please.
Thank you. Honorable Chair, distinguished delegates, it is a great honor to speak on behalf of International Pharmaceutical Students Federation, IPSF, representing over 350,000 pharmaceutical students and recent graduates in 90 countries worldwide. IPSF supports the vision of an European free of vaccine-preventable diseases, where countries provide equitable access to high-quality, safe, affordable vaccines and immunization services throughout the life course. The role of pharmacists as immunizers is expanding, with convenience playing a large part in the growing public acceptance of pharmacy immunization services, addressing immunization coverage for preventable diseases. In England, between 2016 and 2017, community pharmacists administered almost 1 million flu vaccinations to adults at risk through the National Health Services Scheme, an increase of 60% from the previous year. Pharmacists play a vital role in prevention through the diseases, as well as vaccine administration to the public, representing the safest, more efficient and cost-effective measures for preventing, controlling and eradicating life-threatening infectious diseases. Due to this proximity to the public, pharmacists are empowered to actively contribute to patient safety and to the development of safer vaccines. IPSF is committed to contributing to the public health response to immunization by planning and executing awareness campaigns that reach communities worldwide. Through various activities, such campaigns can help change the public perception and their attitudes on the value of immunization, services and vaccines, contributing to the equitable expanding of immunization and stimulating demand among all population groups. Finally, as the voice of pharmacy students worldwide, we call upon member states to encourage the inclusion of vaccine administration as part of the undergraduate pharmacy curriculum to further enable pharmacists to play their part in immunization coverage from their first day of practice. Thank you for your attention.
Thank you very much. Let me inform you that we have also a writing statement, a joint statement of the European Public Health Association, European Forum of National Nursing and Midwifery Associations. Dr. Emiroglu, do you want to respond to the comments and questions raised? You have the floor.
Thank you very much, President, and thank you so much, Member States. 19 of you took the floor, reaffirming your commitment to immunization, which means a lot to us. So thank you so much for this commitment, for calling for increased action in partnerships. Thanks for sharing your experiences and the actions you have been taking in the countries. We took note of all these. And the President, in the sake of keeping a short time, if you allow me, I'm not going to respond and comment to each rich input that has been provided by the Member States, but I would like to just base on 3 points that you have been emphasizing in your interventions. The first one I would like to raise is on the anti-vaccination and vaccine hesitancy, the importance of communication, raising awareness, and also local action to increase the demand. I would like to commit that WHO regional office is going to continue working on that. We already have been leading this work globally. We have a number of tools and materials. I really invite you to use those. And we have certain approaches for local action. So we will be happy to continue working with you on those. Then you mentioned the vulnerable groups, key populations like the migrants. It is critically important to be able to define who is missing, where is the immunity gap, which is very much linked to the comments you had been making on the importance of data. And we agree with that. Monitoring data at the very sub-national level, at the very local level is going to be another area that WHO is going to focus. Then on the global vaccine supply and the procurement-related comments coming particularly from the Southeastern European Health Network, I would like to inform that we will continue working. We have been developing a roadmap for a joint procurement, possibly engaging the interested countries in the SCE, and that work is going to continue. Then the last point I'd like to make is the importance of evidence-based decisions. So let me thank once more the European Technical Advisory Group of experts who had been crucial in giving us the guidance based on the evidence, the most recent evidence, and defining our policies and strategies, which is, of course, replicated in the countries with the national immunization technical advisory groups who have a very important role in leading the immunization work. So as a closing, thank you so much for acknowledging the support that has been provided by the regional office. We are very happy to hear that we are able to support and help you. I would like to assure you that immunization is going to continue to be a priority in the regional office. We will be continuing to support you together in partnership, of course, particularly with the EU, the European CDC, the CDC Atlanta, and thanks to US for the additional remarks, and engaging all the regional and national stakeholders, and also, of course, the civil society, and I welcome your statements. So we are calling for action, and we will be working very closely with you. Thank you.
Thank you very much, Dr. Emiroglu.